Good evening, all of you. Welcome to this program sponsored by the Petaluma Community Relations Council on the issue of alcohol and drugs in our community. Let me share with you before I turn over to our moderator this evening's program, the mission statement of the Community Relations Council. The mission of the Petaluma Community Relations Council is to serve as a coalition of individuals and groups promoting the values of respect, appreciation, and understanding of diversity among all people in our community. By fostering positive human relations, we identify and confront discrimination, respond to the needs of our community, and serve as a source of information and advocacy. I'm Rabbi Ted Feldman, the Rabbi at B'nai Yisrael Jewish Center here in Petaluma and the chair of PCRC. It's a pleasure to welcome all of you here tonight. I'm going to turn our program over to Luz Weyer, one of our coordinating committee members who is going to moderate this evening's program. Lou, please.
Thanks, Ted. So welcome everyone in the community. Tonight we're going to have a discussion on drugs and alcohol in Petaluma. There's certainly been a lot of news in the national news about drugs and alcohol and the problems with those things. And that caused PCRC to say, well, let's take a look at what's happening in Petaluma with regard to the trends that are happening and what actually is addiction, and how does that affect families. And so we have a panel of experts here from both the county and local, and I'll just introduce them and then we'll get our panel started. So we have Dr. Richard von Felt, who's co-founder of Pedantic, and he's a licensed psychologist specializing in addiction in the San Francisco Bay Area. So he's going to talk to us about what is addiction and how what is an individual person's journey on addiction, how does that affect them, and what can we do about it. And then we have Donna Newman Fields, who's the supervising health information specialist on alcohol and other drug prevention programs coordinator for the Sonoma County Department of Health Services from the Behavioral Health Division. And then we also have from our local Petaluma Police Department, Lieutenant Nick McGowan, who's is an 18-year veteran of law enforcement, pretty much done his whole career here in Petaluma, and he's going to talk to us about what are the trends, what are the police seeing in terms of drug and alcohol trends and enforcement with those. And then we also have Elise Hempel, who is Executive Director of Petaluma People Services, which is the primary social services agency in Petaluma, and really does everything. They provide so many services for people in need in the community. And Elise has been Executive Director of Petaluma People Services for over 20 years. So we have a really excellent panel of people to talk about what is the situation with drugs and alcohol in Petaluma and get a good insight into that. And if people who join the conversation, or if you're listening on the radio and you have questions that you want to ask, you can type them in the chat if you're on Zoom, and if you're on the radio, you can send them to, where can you send them? Do you know? Do we have anyone? Where?
APTA 103.3.
No, you can email them to me, ELECE@petalumapeople.org, ELECE@petalumapeople.org, and I'll pull them off full time in real time. So
thank you, Elise. So that's a way for people who are out there listening to send in questions if you have them. Great. All right, so let's get our program started. So first, I'm going to invite Dr. Felt to talk about what is addiction and how does one support oneself, or how does one family member support someone in recovery from addiction?
You all, it's wonderful to be here with you tonight. My name is Dr. Richard von Felt. little bit about me. And first of all, I want to thank the Petaluma Community Relations Council for having me be a part of this wonderful conversation tonight. I hope it's helpful for everyone listening. My background is that I'm a psychologist, and I've specialized in helping people with addictions, both young people and adults and their families, as a career. I've done that working for a treatment center as part of a large healthcare system in our area here. I'm also local, living here in Santa Rosa. And then also, as a result of working with people with addictions, have found a passion in trying to stop the problem before it starts. So Lou, thank you for mentioning, I founded a company called Panaptic, which helps to do things like this, actually provide information to help communities come together to help people so that the problem doesn't start. So what we thought we'd do is talk a little bit about what is addiction to begin with. And before I even mention that, I want to also let you know that I'm also in recovery myself, and have been sober now over 30 years. So I've not only have worked with people who suffer from addictions, but also have suffered from it myself, and am in recovery, and proud to say that. So when thinking about addiction, I think if we really knew how many people suffer from addiction, we'd probably be shocked. And we're talking about drugs and alcohol tonight, but I'd say most addicted people don't even use drugs at all. There's lots of different types of addictions, but tonight we're really focusing on drugs and alcohol. But when thinking about what addiction is, addiction really is any behavior that an individual craves that helps them to feel more just at peace, calm, feeling a sense of relief or pleasure. But as a result of engaging in that behavior, they suffer negative consequences as a result of it, and yet have difficulty giving up whatever that behavior is. So that, tonight, again, we're talking about drugs, but that could be sex, that could be food, that could be gambling. And so I want to talk a little bit about what possibly is the cause of that. What does that look like over time in the very short amount of time that I'm speaking tonight? Addiction is often compared to a disease, and that's according to the American Society on Addiction Medicine, who really describes it as a disease. And I actually agree with that as well. But I also think there's another big cause, which I'll talk about. But we think of it as a disease because once you do become addicted to drugs or alcohol, it's something that is chronic. It means it doesn't go away. It'd be like someone who suffers from having diabetes. And once you learn of this, then it's something that you have to manage the rest of your life. Also, similar to other diseases, it's progressive. So if you don't treat an addiction, you don't know that it's happening, it will get worse over time. So it's progressive. And then also, like other diseases, it's fatal. It has potential fatal consequences. And then lastly, like many diseases, there's treatment for it. So that's when you hear the disease model, which is spoken about in our culture all the time. That's really what we mean by that. So when thinking about addiction, and many of you, if you're listening and you know of someone who might suffer from addiction, or maybe even wonder yourself, addiction is something that's not a choice. It is once you become addicted, a person is feeling stuck, feeling overwhelmed, feeling kind of questioning how they got there in the first place. And part of the reason why that can be so hard is that addiction develops very slowly over time. And as it develops, it really changes both our behavior, but also the way we think. And one of the reasons why is that when we become addicted to a drug, it affects our neurochemistry, in particular our dopamine, which is a neurotransmitter our brains release. So dopamine is something, is a neurotransmitter that we need to survive. Without it, we wouldn't live very long. It's the very thing that really spurs our basic drive. So when you drink water, you get dopamine release. When you eat food, you have dopamine is released. When you have sex, you have dopamine release. When you're feeling nurtured, you have a release of dopamine. It's part of our reward center. But what happens when someone becomes addicted to something is that with our basic drives, there's also mechanisms in our brain that help to regulate these drives. And so, for example, if I go down to Noble Fork and I have a cupcake, I'm going to have, which I love, Noble Fork cupcakes. Sorry, it's not I'm not being paid to plug Noble Fork, but I do think they're amazing. I get a dopamine release once I take a bite out of a cupcake. But my other part of my brain, my frontal lobe, says, if you eat an entire box of those, you're going to get sick. So it kind of helps me to balance my drives. What happens with addicted brains is that the part that helps to regulate your drives it starts to malfunction. And essentially, our brains start to work against us. So in a sense, the addicted brain can't defend against its own cravings, which is why, I would want to really emphasize that someone who suffers from addiction doesn't have a lot of choice in the matter. This is something that's happened gradually over time. And it's also something that I would say is both conscious and subconscious, the very thing that's causing it to begin with. Essentially, it's like your brain becomes hijacked, such the rational part of our brain doesn't work as well as it did before the addiction started. So to take that a step further, people who suffer from addictions most oftentimes are, and I would argue almost all times, are people who suffer from some type of emotional pain. And we all as human beings suffer from emotional pain. So it's something that any one of us can relate to, which makes the person who suffers from addiction and us not so different. It originates in a person's, attempt to solve a problem, perhaps, or someone suffering from depression, or a sense of loss, or a sense of isolation, or loss of control, or a deep discomfort with yourself or your own identity. And so some would argue, and I'm a big fan of Dr. Gabor Mate, who thinks about addiction as relating to a form of trauma that we've had. And when I say trauma, that could be anything. Most of us think of something really violent or awful happening, horrific, but I don't mean that only that type of trauma. I mean traumas that something as simple as someone who had a parent who was very busy when you were a child and couldn't meet your own emotional needs as a child because of how busy they were, or even a very attentive parent who wasn't able to attend to your sensitive needs that you were going through. Perhaps you were dealing with sexuality issues or your own cultural identity issues, assimilating to moving to this country. I mean, there's any number of reasons that could cause that kind of emotional discomfort. And those types of traumas oftentimes are what's behind an addiction. So I say all of that because to help someone who suffers from addiction, we're ultimately wanting to ask the question, how, we tend to focus on the behavior of the addiction, which is the obvious part of it, but that's really just a symptom of addiction. Because when you use marijuana or alcohol or any kind of drug, you get a gigantic dose of dopamine, back to the dopamine theory I was mentioning earlier, but it's way more than you would have if you had food or water. It's a gigantic dose of dopamine. So much so that it creates a sense of immediate calm that then the brain starts to crave, that sense of calmness or relief that you get. And essentially addiction, the system of addiction is this craving for relief over and over again, but it becomes just a way of, even some of the addicts describe it as just wanting to feel normal, wanting to feel just, So when looking to treat addiction, we need to look at, really understand what's the pain that underlines this effect, rather than just the causes, because and that helps to really meet someone where they are as a human being who's suffering. When someone's suffering from an addiction, and as I mentioned to you, I have suffered and I'm in recovery myself. It's an experience that's laden with a lot of shame. It's a very, very lonely experience. We live in a culture that stigmatizes addiction, so it's not something you can talk about freely. Oftentimes the addict blames themselves in ways that's far too simplistic for what's actually occurred gradually over a number of years or even decades. And so when you're looking to help someone who suffers from this, you've got to realize that it's a terrifying place to be, because if they're suffering from a drug addiction, the thought of removing that drug is essentially like saying, I'm going to take away the very thing that gives you relief on a regular basis. The thing that helps you deal with your anxiety, your stress, your sense of overwhelm in life, and your sense of real safety, your basic safety as a human being. And this is why when people are faced with the idea of getting help, it's terrifying, because they can't imagine a life without it once you've got become addicted in something. Then of course there's all levels of addiction, and so I'm speaking to kind of a pretty broad continuum when I'm explaining in this way. But if we're wanting to help someone who suffers from addiction, we ultimately want to get them connected with a professional who can help understand the kind of pain that they're going through, who can meet them where they are and help them be seen not just as a person who's addicted, but just as a human being who's suffering and needs help. The good news is, while our brains start to work against us when we're addicted, with treatment, you can heal the brain, and you can help someone to become in recovery. And I'll let you know that recovery is a lifelong journey. So it's not something that you do over a couple of months or a year and then you're done with it. So you become part of a journey that's to treat a lifelong condition that requires regular management. And to learn how to do that takes time. It's not something you can read in a book or kind of, if you're an intellectual, just gather on your own. It's something that really requires learning from others, but also to really slowly learn how to be compassionate towards yourself and learn how to ultimately love yourself and be able to provide that relief without having to reach for something or engage in a behavior. So when getting people help, we want to think about not only how to help with the emotional pain, but there oftentimes are medical issues that are happening. So I'll want to, oftentimes have someone meet with to deal with any kind of medical issues. It could be chronic pain, it could be insomnia, which is really common with a lot of addictions. We need someone a lot of times to meet with a medical doctor just to deal with the kinds of withdrawal symptoms that come along with addiction. So that's a really common part of the help. But then to help someone become part of a recovery community, and there's lots of different ones, including ones that we all know about, like 12-step, but also Life Ring and Dharma recovery, refuge recovery, that are more east-west versions of recovery. There's agnostic versions, there's scientific versions like SMART recovery, but help people get connected to support systems to help them to engage in their own healthy passions and re-engage in the life that they had prior to becoming addicted. So I will be open to questions later on if people would like to ask, and I'm sure as a panel we'll be talking to each other about the things that we're bringing up tonight. But that's a kind of a short overview. Hope that sheds a little light on what addiction looks like.
Yes, thank you, Dr. Felt. That was really, really terrific insight. Gave me a lot of insight into how does addiction happen, what's the mechanisms for it, and something that I didn't realize, but I see more clearly now, is that thing about the addict being afraid to give up their addiction. That's terrifying because that's how they cope with whatever difficulty they're having, and so it makes much more sense to me why it would be hard for them to give it up. They need to find another way to cope, and that's part of what treatment is about, I'm sure. The question that's in my mind is, and that I'm guessing maybe in the question of others listening, is so if I'm someone who thinks I might have an addiction problem, how do I know that? Is there a way to kind of self-assess? Or if I'm a family member and I have someone that I'm concerned about that I think they might have an addiction problem, how can I judge that?
So if you're someone who yourself wonders if you have an addiction problem, you would find yourself caught in a cycle that creates negative consequences. That could be consequences that could have you not enjoying the things that you used to enjoy on a regular basis. You no longer are interested in relationships without engaging in that drug of choice. Something as simple as a sunset might be less pleasing, or dinner with a family, or music or food, hobbies you might have lost interest in. So the negative consequences could be any number of things, but ultimately less satisfaction in life. But the most important thing is that you've lost control over that behavior of using the drug. You've told yourself over and over again, I'll stop tomorrow, I'll only use that much, I'll switch that drug for that drug, I'll use this amount, or maybe I'll only use that drug on Monday, but not on Wednesday, but on Saturday I'll have this. And you keep breaking promises to yourself over and over again. So that's what it might look like, for you personally. If you have a family member who's suffering, the best way to help is with a very compassionate, non-labeling approach where you share your concern with that person and you name a behavior that you've seen without labeling them, and notice and say how this is affecting you, and that you want to be there to help them. Sometimes family members can also talk to professionals like myself or others. There's a large body, obviously, in our area of addiction specialists who can help them, even prep them for that conversation. Because it might mean that you need to understand what addiction is before you can begin to even have that conversation.
Great, thank you. And when you said drug, like I want to use that drug, you're using the drug in the broad sense. It could be any of the things you talked about, like food or sex or shopping, or
that's right.
People get addicted to lots of different things. Yeah,
absolutely.
As well as drugs and alcohol.
That's right.
Okay, all right. Thank you so much. So next we're going to get into talking about interventions and prevention. And for doing that, we're turning to our county person, the person from the county Department of Health Services Behavioral Health Division, and that's Donna Newman Fields. So Donna.
Hi, good evening, everyone, and thank you for the invitation to be here. I wanted to start out by saying I work for the county, but I'm a longtime resident of Petaluma, and I even worked here long before I moved here. So I go back to the late 70s of being involved with Petaluma. And for all those years, I've been very concerned about the health and well-being of the community. My role with the county, I've been with the county 15 plus years, and I've been focused primarily on substance use primary prevention. In other words, we want to do all we can to prevent use from starting, and we want to intervene before referral to treatment is needed. Our efforts are based on an assessment that we conducted in order to prepare our new 5-year strategic prevention plan, which goes from 2020 to 2025. We collected data, and what the data showed us, the data informs all of our programming. And what the data showed us was that the substances of concern in this county happen to be alcohol, cannabis, prescription drugs and opioids, and methamphetamine. We utilize something called environmental prevention. We use environmental prevention strategies. In other words, we want to look at what role does the community play in all of this. We often default to the schools and say, why aren't they doing it? But what we look at in environmental prevention is what is the community's role? What are the community norms? How is the community supporting or not supporting these issues? One of our goals is to provide science-based information to the community. We want to increase awareness, and we want to make sure that people have information that's valid and accurate so they can make healthy lifestyle choices. Another aspect of environmental prevention, it involves policy and systems change, and we support community-wide initiatives that speak to the role that the community plays, as I said, in the access and availability of substances. As an example, we're all well aware of the uptick in DUI crashes and the blood alcohol levels are rising. But I have to tell you that every time I read one of those articles in the paper, I'm horrified and I'm upset. But the question I ask is, where did they get the alcohol? Where's the alcohol coming from? And we're speaking about alcohol right now. Were they overserved at a bar or restaurant? Were they just leaving a party? What happened? And if they're underage, well, that's an even bigger question, because we know that when an underage person gets alcohol, there has to be an adult involved somehow. Either they sold it to them, they turned their back on it and it was stolen, they let them drink it in their home, and even worse, they actually provided it in their home. From 2011 to 2018, the county conducted what was called a Place of Last Drink survey so that we could answer some of these questions and get a better idea of where and when overuse was happening. We asked questions like, where were they drinking? Where did they live? Where were they stopped and arrested? What time of day? Did they have kids in the car with them? And more. The survey is under revision now, so because the questions are not just about alcohol anymore, we wanted to include other substances in addition, like cannabis and opioids and prescription drugs. And sometimes all those drugs are used at once, or, we just want to make sure that we're really understanding impairment when it comes to driving. The original survey was administered in the county's DUI program. And as we began to analyze the data after that first year, it surprised us that over a third of the respondents were saying they were coming from home or someone else's home. And 2/3 of them believed that they were okay to drive when they did that. In 2018, that number of people coming from home or someone else's home who were arrested in Petaluma, that number was closer to 40%. The dilemma we faced was, what could we do to prevent overconsumption by adults in their private home during a party or watching a sporting event? To put it bluntly, Uncle Joe was leaving the party intoxicated and nobody stopped him. And he ended up with a DUI, possibly a more tragic outcome. So we created a flyer at one point that really tried to address, how do you host a safe party? It's as simple as that. We gave some bullet points. This is how you do it. We're not just talking about, we originally released it for winter holidays, but now let's face it, we're talking about the winter holidays, we're talking about prom and graduation, we're talking about the July 4th, we're talking about all of the, again, all of these events that might happen in somebody's home. We haven't updated it lately, but I have to tell you that when I looked at it recently, the bullet points were still very valid and the information is still really useful. It might be interesting for you, those of you that don't know, that in 2006, Petaluma actually passed what's called the Social Host Ordinance. And the Social Host Ordinance was designed to hold adults accountable for underage alcohol consumption on their property. To my knowledge, and maybe we can hear more from Lieutenant McGowan, but to my knowledge, I don't believe it's being really readily and routinely enforced at this time. There were community members years ago that really wanted to amend that ordinance and bring it up to date. And I say that because many other communities in the state and across the country have amended their social host ordinances, which originally focused on alcohol. But what they've done is they've included alcohol, cannabis, and other drugs. So again, being consumed on the property for underage youth. You might ask, well, what about the individuals that were drinking at licensed establishments, right? The county has been providing what's called responsible beverage service training for 15+ years. I've been a strong supporter and advocate of RBS training as a prevention and education tool. Another ordinance that you might not remember or know about was passed in 2007 here in Petaluma. It's called the Alcohol Related Nuisance Ordinance, lovingly called ARNO for many years. and it mandated responsible beverage service training for everybody that worked in a licensed establishment in Petaluma. I don't know how much that's being enforced now. And I have to say, it's really, a lot of other priorities started to kind of rise to the top. And some of these ordinances, I think, have been forgotten about. But now, beginning July 1st, there's a new state law, Assembly Bill 1221, which will go into effect when it goes into effect July 1st. It will require all servers and managers in on-sale establishments. So on sale is bars, restaurants, wineries, breweries, brew pubs, wine tasting rooms. Any place where the alcohol is consumed on the premise is considered an on-sale establishment. And everybody in the state will have 30 days and 60 days until August 31st to take a 4-hour approved RBS training. I am happy to say that the county has an approved training. We were approved in May of 2021. So our training is approved by the ABC, and we're currently implementing it and teaching a couple of times a month. Pre-COVID, with the support of the Petaluma Police Department, we actually offered these trainings in person, and we brought them to Petaluma several times a year. But since, of course, March 2020, when we all pivoted, we pivoted to a virtual training, and we're still doing the Zoom format today. We have one active trainer who's covering all of that. We hope to expand our ranks. We're looking for individuals who might want to learn how to teach RBS, preferably law enforcement. And the way that the trainings, as this new law gears up, there's going to be more demand and more interest. And it would be great to have some Petaluma trainers that could teach under the county's umbrella our approved training and provide that training on a more regular basis here in Petaluma. So what about the other drugs? We continue to partner. Richard mentioned that he co-founded a group called Panelists. We've been working with Panelists for over 3 years now because we have the same goal, which is to prevent substance abuse and substance misuse. And together with Richard's group, we're providing science-based information about cannabis to all age groups and to healthcare professionals. We're hosting an evening on April 7th on cannabis use in pregnancy, a conversation for new and expecting parents. Last week, we hosted a professional training on cannabis use in perinatal health. Coming in May, we're going to be, we have several offerings for a Mental Health Awareness Month. Mental health is a really big issue these days, especially with COVID. We know that a lot of young people and adults are suffering from mental health issues. And I also want to say that we're partnering with Panelists to bring a program, e-learning program that they developed called Impact. And we're bringing that to Sonoma County. We hope to bring it to some Petaluma schools. That would be great. But it's a program that's been implemented in other parts of the country and has not yet made its appearance here, its debut here in Sonoma County. And so we're really excited. We're sponsoring a couple of informational sessions. If there are schools that you know of that would be interested in participating in that. We also partner with a group called the Social Changery to offer information to youth through social media channels, including Instagram and TikTok. There's also a website, cannabisdecoded.org, that's geared specifically to youth and young adults ages 14 to 25. With the Social Changery, we have produced information for the LGBTQ+ community on cannabis and what's called rainbow washing, which is just putting the rainbow colors on all of these cannabis products. And so we hope to have that available soon. We created a DUI palm card that highlights the use of cannabis and how that can impair your driving. We have those cards available electronically. We also have physical copies of them if there's interest. Last month, we partnered with our tobacco prevention team from the county to offer several evening presentations on what's called the triangulum. We're looking at the coming together, the convergence of tobacco, nicotine, THC, and e-cigarettes. And so Richard was part of all of those sessions that last month. And I will tell you that if you don't know, the city of Petaluma recently passed a tobacco retail license ordinance. And so beginning July 6th, tobacco retailers in Petaluma will not be able to sell flavored tobacco products, e-cigarettes, and they can't conduct any promotions or offer coupons. So that's coming soon. The county has an active Sonoma County Prevention Partnership with several subcommittees. The Youth and Young Adult Subcommittee helps guide and inform much of the prevention programming I just shared, including our Friday Night Live Youth Leadership Youth Engagement Program, which I didn't mention earlier. But currently, we're working with the Northern California Center for Wellbeing to implement our Friday Night Live program at Petaluma High School and Casa Grande High School, along with other locations in the county. We also worked with the Rohnert Park Cotati Unified School District to have Friday Night Live chapters at Rancho Cotati High School, Lawrence Jones Middle School, and El Camino High School. And there are other chapters in Santa Rosa and Windsor. So we hope to we're always looking to expand our Friday Night Live program. Our other subcommittee is the Opioid Prescription Drug Subcommittee. We know that overdoses are much on people's minds these days. So what are we focused on there? We always are looking for safe medicine disposal, ways to dispose of the medications, get them out of your house, out of the reach of children and other people. And twice a year through the Drug Enforcement Agency, there's a program called the Take Back Days. Petaluma's participated many times, and they will again the end of April. That's where you can just put all your unused, dated drugs in a baggie and just drive to the Petaluma Police Department and drop it off. It's a really easy way to dispose of your drugs. We also are working on prescribing guidelines to update our prescribing guidelines so that medical professionals are not overprescribing opioids. We're well aware, as I said, of the concern of the extremely high rate of overdoses. Sonoma County has one of the highest rates of overdoses in the state. Many of these overdoses are accidental, and they're due to the prevalence of fentanyl. I just heard the other day that over 90% of heroin that's on the streets today has fentanyl in it. We're providing information and education to the community as best we can. And we did that back in December when we worked with the Petaluma City Schools, and the other co-founder of Prenaptic, Dr. Sarah Cunningham, presented on fentanyl and opioids at that session. We hope to continue our efforts to expand the availability of Narcan, or it's often called naloxone, which can reverse an overdose. I heard once that everybody should be trained, just like you're trained on CPR, to be trained on how to administer Narcan. We're supporting something called OD-MAP, which is an overdose tracking system that actually inputs data in real time down to street level. So that means that wherever an overdose happens, whether it's the person is saved by Narcan or it has another tragic ending, we'll know where it happened, right down to the street and the spot where it happened. And that can really help inform our educational programs. So hopefully the Santa Rosa Police Department is active now with OD-MAP. It took a while to get it going. I know Petaluma is interested, and we also want to bring on other police departments, EMT departments, fire departments, and other first responders, so that we have a way to countywide really kind of start to create a map of where these overdoses are happening. We hope to host a countywide opioid summit in June. And we'll be partnering with a national organization called the Community Anti-Drug Coalitions of America. And interestingly enough, Walmart has an opioid stewardship initiative. And so we'll be partnering with them to do some virtual reality trainings and programs on naloxone and how to administer nasal naloxone. We'll be partnering at the same time with the Northern California high intensity drug trafficking area, as well as the Sonoma County Public Defender's Office, local hospitals, treatment providers. More to come on that as we kind of put the plans together. So I'll kind of stop there. We have a lot going on. And again, our primary interest is primary prevention. How do we prevent it from starting in the first place?
Yeah, thank you so much, Donna. So I'll just comment that, as a resident of Petaluma, it's always amazing to me the things that government does, like that the county does, often are invisible to most of us most of the time. And so to listen to you talk about the range of educational things, flyers and cards and programs and education for servers, and the range of programs that you have going to try to have an impact on this problem is unbelievable. And so it's great that people are getting a chance to hear about them. And we also will be there's a list, a PDF with a list of agencies and programs, and that we'll be posting in the chat that people can download, and will also be available on the website where the recording of this session will be, so that there'll be an access to those resources and information about that stuff. I'm curious, listening to you talk about all the different educational programs and the kind of ordinances that are designed to kind of try to help people act responsibly, even though they may be suffering from addiction. That's such an interesting contrast to what Dr. Van Felt was saying about that addiction really is an emotional problem, and so I'm sure education has a positive impact, but it just made me think about, are we doing things, or what components are there to help people deal with the emotional part of addiction, not just not making an intellectual decision to do this or that. And I'm curious, I mean, I'd be curious what you have to say about that, but I'm also just curious if the trends, with all the programs that you have in place, do you know if the trends are getting better, or are they getting worse in Petaluma, in the county?
Well, let me just say again that our focus is to prevent use and abuse in the beginning. In other words, we want to go upstream. We
Yes.
really want to get ahead of the addiction piece of this. The trends, prevention is really an interesting animal, because it's often hard to quantify what you've prevented. If you've provided education to somebody working in a bar and they don't overserve that patron doesn't go out and cause an accident that harms a family coming home from vacation. How do you quantify that? So, I think that we're up against a headwind for sure. The COVID didn't help. I was just reading today, there's a new study out that there's been more alcohol related deaths than COVID deaths in this country. And so, it's staggering to know the extent of the problem. And I think that, as I said earlier, there's severe mental health issues happening, and oftentimes there's substances involved with that. So some of the conditions are out of our control, and all we can do is the best we can do. And as I said, we just want to make sure, and these days, whatever position you take on whatever issue, you can find something to support it on the internet. And so what we're really trying to do is use science-based information so that people have what they need. We've heard from young people, just give us the facts, tell us what's true, and then we'll make our decisions. And that's all we can ask. We can't determine whether a young person whose brain isn't fully developed yet, that they're going to make the right choices all the time. And that's where the community comes in, right? We have to all be in this together.
Thank you. Thank you so much. Well, thanks for all that information, and thanks for everything that you're doing. That's and the question about what the community could do, or programs for people that are having problems. PPSC, which is Elise will be talking about that. She's our fourth guest. Before we get to that, though, we want to hear from the police department, and so we have Lieutenant McGowan, who's going to talk to us about what are we seeing in Petaluma with regard to incidents or trends for addiction and drugs, and how's law enforcement responding to that?
Thank you, Lou, and thank you, PCRC, for giving me the opportunity to participate in this panel. First, I wanted to kind of echo something that Donna was saying, and it's a Benjamin Franklin quote that says, "An ounce of prevention is worth a pound of cure." And if we can get ahead of it before it starts, then we're going to be much more successful in the end. The current statistics on what's going on in the Petaluma community are pretty eye-opening. They're pretty they're scary when you start to actually run the numbers and you look at what's going on in our community, specifically when it comes to substance abuse, things like driving under the influence of alcohol and drugs, being under the influence of specified controlled substances such as methamphetamine or some of your opiates, to possession of certain classified drugs that historically were felonies, and we changed legislation in the last decade to make some of them misdemeanors, which is part of the issue and part of why we are where we are today. So just to give kind of a glimpse of where we are currently with DUIs in 2022 this year compared to where we were the same day last year, we're up 230%. So we've arrested 230% more people for driving under the influence of alcohol in 3 months of this year versus the same 3 months last year. For possession of Schedule II controlled substances, which would be things like most of your opiates, your narcotic analgesics, plus cocaine, a lot of your highly addictive prescription drugs, we're up 40%. For possession of your Schedule I's like methamphetamine, we're up 20%. For people being under the influence of controlled substances, we're up significantly, a couple 100%. And the same thing with possession of drug paraphernalia. So as you can see from the variety of different legal sections that people come in contact with law enforcement for, we are blowing our statistics out of the water, for lack of a better way to put it. Due to that, what we are seeing is we're seeing an increase in what we call as person crimes or violent crimes. Just for the month of February, we had a 37% increase from February 2022 when compared to February 2021, 37% more people crimes, which include things like aggravated assault, crimes like robbery, crimes that, are severe and, are a great risk to our communities. And the one that I find most interesting is when it comes to robbery. And this I can tie directly to some of the substance abuse issues that we're experiencing in our community. From 2022 February to 2021 February. So we had this year, we had an 80% increase in robberies. 2 of those robberies that we had were at local pharmacies for the sole purposes of stealing opioids. As Donna said, we have a significant increase in opioid use and abuse. Some of that is because of the ease of obtaining it through the fentanyl and heroin on the street. But another side of that is people that are, entered into pain management and they become addicted to a substance based on the length of time that they're prescribed that particular opiate. The problem is, pharmaceuticals are very expensive. They require a prescription in terms of your narcotic analgesics or opiates. And when you can't get them from a physician or a pharmacist, then you resort to the street. And as Donna indicated that, what we're seeing is most of our narcotic analgesics on the street are laced with fentanyl, which is significantly more potent than your traditional diacetylmorphine or heroines. And as a result of that, we are administering a lot of naloxone, which is the Narcan. I have last year, Petaluma Services, so Petaluma Fire and Petaluma Police Department administered Narcan 35 separate times. And out of those 35 times, we had a 95% success rate. Unfortunately, we lost that 5%, but it does show that, the naloxone is working, and it's critical for us providing services when it comes to life-saving efforts. Currently, because of the fentanyl epidemic or the fentanyl problems that we're seeing, we no longer test drugs on site to determine what the chemical structures are. We have to send them off to the lab. Due to the heavy case log or backlog of evidence at the Department of Justice, we don't get all of our drugs tested. So I would presume that we have more fentanyl on the street than we actually know. And the reason why we don't test them on site any longer is because of the toxicity and the potential for exposure to the officers. We have had officers exposed, which require immediate medical attention. And most officers will carry 2 naloxone, one for an individual they may encounter during a call for service, and the other in the event that they get exposed to the substance that they can self-administer to basically buy some time until emergency medical services arrive. The drugs in our current community, what we're seeing, a lot of it is probably directly correlated to the pandemic and isolation. And what Dr. Felt talked about with dopamine. There's other neurotransmitters in the system, such as oxytocin, that help regulate dopamine. But when we don't have human interaction because we're quarantined or in our houses and not going into the workplace, we end up not getting some of those critical neurotransmitters that help regulate our mood and what drives us as people. So fast forward to where we are today, I think we have a huge issue at our hands that we need to address through education and partnerships. Some of the partnerships that the Petaluma Police Department works with is obviously the Petaluma People Services, with the SAFE team and our community on the shelter list. We also work with the Office of Traffic Safety and have DUI saturation patrols, DUI checkpoints, do traffic safety operations, specifically geared towards trying to reduce the number of impaired drivers on the roadway and make our roadway safer for the community to enjoy. We're also partnering with Project Zero to try to reduce fatalities when it comes to vehicle collisions. We have, as Donna said, the drug take back program, where we do take drugs off the street for disposal. We participate in the RBS educational opportunities. And then I would think the most important right now is our district policing model, where we have officers assigned to various districts throughout the city. And our officers that are assigned to the downtown area, they frequently check in with our restaurants and bars to ensure that we are aware of events that are coming into town, that we have adequate staffing for nighttime hours, make sure that we have safety plans in place, and ensure that the different businesses are complying with their conditional use permitting, to ensure that we can mitigate some of these issues that are becoming very prevalent.
Wow, thank you, Lieutenant McGowan, for all that information. That's a lot. That's so very sobering numbers to hear about the increase. And I was going to ask you, I was thinking while you were talking, do you think it's because of the pandemic? And you talked about that. You do think a lot of it has to do about that. And I find I'm very heartened to hear, your understanding of like the dopamine and how the human body works and the need for connection and how that might contribute to people abusing. And it's great to know that police officers in the field have that kind of understanding when they're approaching people that are having a problem. I'm curious to, is there something you wanted to say about that?
No, I just wanted to say that, so part of my job is I teach physiology and it's called drug abuse recognition. So I teach officers how to evaluate people under the influence of controlled substances. And part of the education is understanding the physiology behind it and what manifests in an individual when they are suffering from addiction, and to treat the person that's suffering as a human. And that it really can happen to every single one of us. All of us that are on this panel, all of us that are participating and listening at home, the reality is that it's a physiological response, and the human body is made a specific way, and it's no different from a person that is on the street or a person that's in a medical facility. We all act the same, or we're all susceptible to the same processes. So treating the person as a human is critical when it comes to how police officers interact with people that are suffering from substance abuse, as well as mental health and a variety of other potential issues.
Yeah, thank you. I'm so heartened to know that our police officers in the field have that kind of understanding. I wanted to ask you, the SAFE team is relatively new, and I know they are responding to substance abuse type situations. How is it determined, like whether the SAFE team gets sent out or whether another kind of officer gets sent out?
We triage the calls based on whether or not a criminal act is being committed. So for example, if a person's under the influence of a controlled substance, by law, that's a criminal act, right? If you're under the influence of methamphetamine in the street and you're, that is a violation of 11-550. However, we don't treat that as a criminal violation because we understand some of the disease and what's going on. So if the person is acting violent or aggressive towards other individuals, then that would be more of a law enforcement response. If the person is not committing an additional criminal offense, then we tend to default to the SAFE team. And they're very effective and they work very well with our vulnerable and at-risk community. That includes some of the shelterless as well as our substance abuse population, because they just have a different set of tools that allows them to communicate and to de-escalate situations that, you know, may end up in a custodial situation if law enforcement had been responded or dispatched. So it's more, we triage the call based on what are the circumstances and does it require a person that has safety equipment, or does it require a person that has a little bit more understanding in the mental health and clinical aspect of what they're experiencing.
Okay, thank you very much. And thank you and all the officers for the work that you do in the city. All right, so let's move on to Elise Hempel, Executive Director of PPSC. They have a bazillion programs for supporting people that need help in the community. Elise, what do you want to tell us about what PPSC is doing?
Well, thank you. And thank you to the PCRC for being here and hosting this. We would be remiss if we didn't acknowledge, because usually when you're in person, you have to acknowledge elected officials. And I want to thank Dr. Posake, who's the Vice Mayor, for joining us tonight. It's always a pleasure to see his screen pop up at almost everything that is happening in our community and being connected to everything that is going on. And I'm sure through his work, he's completely immersed in addiction issues and substance abuse. So at Petaluma People Services Center, we like to think that we're on the prevention and intervention side. And a lot of the work that we do is geared towards that. But most of our work that we do day in and day out is dealing with people who have vulnerabilities that could turn into addiction issues, vulnerabilities that have led to addiction issues, and compounded with additional stress and trauma. Like Dr. Von Pelt talked about, the trauma that we experience even as a youth can really impact how we are and how we grow up. I think we shared that I've been here for 20 years now, and it was about 19 years ago when we started a program in the Petaluma City Schools called Project Success. And I'm flashing back to this because I think Donna was part of this. And this was a prevention and intervention program led by clinical staff that actually worked on campus. And one of the things that we did with these young people was through a large gathering of youth or an assembly, we handed out little bricks. They look like pieces of bricks. And we asked the kids to write on the bricks how alcohol or drugs have impacted their life. And some of them told really poignant stories about how it had impacted their life by stating that you maybe become a mother. You may need to, you may get kicked out of your home. But the ones that resonated with me the most were the ones where youth in our community were talking about how addiction had impacted their family, whether it was a parent or a brother or a sister or an uncle, and their addiction issues changed how their family interaction happened. And so when we talk in our community about the needs and where we need to focus, it has to be a comprehensive look at all of the things that we provide. Now, I did put lists of resources, and there's always lists of resources for people to follow up on. But again, to the conversations that we had earlier, one of the things that an addiction, especially if it's drug and alcohol, is all of a sudden you feel calm. So I've used, and now I don't need to feel like I need to call and get that resource. I don't need to call and talk to PPSC to get access to additional programming. I don't need to look at all the other resources because today I'm feeling pretty good. Now, tomorrow I may not use and I may be all hyped up and I may need to actually call PPSC. But if I use, I might not be okay, or I might feel better. So those are things that we have to wrestle with as a community. And the other thing we have to wrestle with is there's not enough resources. I would love to be able to tell you that with all of the 72 programs that we provide, we're able to touch everybody in the community, especially when it comes to drug and alcohol use. And we are only touching that top tip of the iceberg. And we need to do better as a community. We need to do better by advocating and working with Donna and her team at the county and taking it a step higher to the state and saying we need more resources for people to be able to have access to programming that helps them meet their addiction need when they need it met, so that we can then get them on the path to solving the other issues that they're dealing with, whether it be their addiction issue led to them possibly losing their apartment, or their addiction issue has led them to having their children participating in our adult protective or child protective services counseling programs. All of those things touch us in such different ways. You know, it's interesting, we talked about the SAFE team earlier, and I was lucky enough to be with two of the SAFE team members when they met the city manager for the first time. Because everything's been happening on Zoom, she actually hadn't even seen the vehicle. And so the chief and Deputy Chief Miller and the city manager all came out, and they met a couple members on the SAFE team. And this is their response is not something that I was unfamiliar with. I was just surprised how blunt and factual they were about it. So the city manager was saying, you know, we're so proud and excited to have this program, and we know the numbers of people that we're touching, but what do you need? What can we get you? You know, and I'd heard this day 3 when the SAFE team came back from their first real ride along. They looked the city manager in the eye and said, we need a sobering center in this town. We need a place where people can go and feel safe and get sober, and then get the access to the resources. And so, you know, there's a lot of things on my list, but that is one of the things on my list. And it should be on the list of everybody in this community to figure out how we can provide that additional resource for people who say, I'm ready to get help, to be able to come and get help and be connected to all of the different resources that we have. And that's what's going to help us learn as we go along to be better at helping people move through addiction issues and move to a place where, yes, they're going to deal with it for the rest of their life, but they're in a place where Dr. Van Pelt said, they're in a place where they are able to deal with that addiction issue, and they're able to survive, and they're able to be contributing to not only helping to lift themselves up, but lifting those around them up too. So that's really all I have to say. I got something else on my list, is what you all need to know.
Yeah, so that idea of because as you were speaking, Elise, I was thinking, you know, as a community member myself, I'm thinking, yeah, okay, so the community has to do stuff too. Like, so what can we do? Like, is there stuff that the community could do? Yeah, so and I hear you saying a sobering center. I don't know if that's what you think the community could do. That sounds like another program that we probably need money for. I don't know if there are other community things you think could be happening that aren't necessarily just with big funding.
Well, I think Nick McGowan talked to it earlier. With the pandemic, there's been so much isolation. So many people have not been able to be out and connected, and we're seeing that that number is still continuing to be impacted for our residents who are 60 and older. Those that have maybe retired, they didn't have to get up and do a Zoom call for work, and that isolation has led to more issues around addiction among those who are older. So our groups that we're leading now for addiction issues are populated with people who are 70, 75, and 80. And they're trying to figure out how they're going to survive the next 10 years of their life and try to get the help that they need. And so it's programs and volunteering. We have that goofy little program that we started the day after the pandemic that has 3,000 volunteers calling 3,000 seniors in Sonoma County. That connection is saving somebody from making the wrong choice. That connection is, I better get up. I know so-and-so is going to call me. That connection is, how are you feeling today? Tell me why you don't feel good today. Maybe we can talk about it. And so those are the things that we as community can do. And I want to encourage the community to look around at what's been successful. We talked earlier about prevention and intervention and getting as far upstream. Look at things that have been successful and help raise those things up. Don't create something new, because creating additional nonprofits and additional programming that doesn't necessarily fit is really hard to do. I encourage everybody to look at what's been successful. How can we raise that back up? And, you know, again, the community can get involved in a lot of ways, especially with things like bringing back Project Success. It doesn't exist anymore. And to me, that was one of those programs that we just need to advocate as a community, as parents, as educators, as school districts, and people who actually are seeing teens in their community who are not in school when they should be in school. Those are youth that should be in Project Success, because those are youth that are getting into the prevention and intervention side before McGowan has to arrest them for being drunk on the streets. And of course, we have diversion programs in the city. Or the Petaluma Police Department and our Mentor Me program have built an amazing diversion program for these youth. But let's get to it before they actually have to get arrested. Let's get to them before they start to use, before they use that as the choice of just numbing themselves out, and then that leads to their addiction. So there's a lot to do. There's a lot to get involved. It's pay attention. It's, you know, the people who took the time today to just dial in and listen to this conversation. It's sharing this link out with others so that we understand and we know that there are programs that we can refer people to. There are programs where we can get additional help, and there's ways that we as community members can continue to be involved.
Thanks, Elise. So that program that you mentioned that has 3,000 people supporting people, what is that called?
It's called You're Not Alone.
You're
and
Not
it
Alone.
continues to grow. It continues to grow. I need more volunteers.
I was going to say, so community members could volunteer for that.
Yep.
Community members could also volunteer to be a mentor at Mentor Me. That would be something.
Absolutely.
Yeah. So look for ways to volunteer with PPSC or
And
other
community
resource organizations.
I expect to see all of you standing in front of Dr. Posake and when he's sitting on the dais saying, we need a sobering center. That's your task.
Yeah. So I'm curious if any of the other panel members, I'm sorry, Ted, you wanted to say something. Go ahead.
Yeah, no, I just had a question actually to ask, if that's okay. Okay, at this point, I was going to ask Lieutenant McGowan his response to Donna's questions about the social hosting ordinance and the enforcement of it, and what's happened with those aspects of that over the years.
Yes, so the social host ordinance is a Petaluma municipal code, and Donna is correct that the social host ordinance has not been updated since 2006. So it specifically deals with alcohol and is more geared towards our juvenile or underage parties. It's mildly effective, and that's mildly effective in terms of when we were enforcing it, which was pre-pandemic. Since the COVID pandemic, we haven't really had very many juvenile parties. Therefore, there hasn't been a need to enforce the social host ordinance. I have seen the revision that Donna was talking about, where it specifically called out things like cannabis and other drugs that might pertain to some of those gatherings and parties, which would be more encompassing, because it would all be enforceable to a broader demographic. So when you have a large, venue or an event at a house where people are using and abusing drugs, we would have the authority to, basically disrupt that party or end that party early, based on a municipal code that we don't necessarily have right now. But I would say that we don't have the need right now either. So it might be something worth revisiting in the near future with the city council to, change some of the wording in our social host ordinance. But there's other things that I think we should tackle first.
Thanks. I'm curious what others on the panel think about the idea of a sobering center in Petaluma.
I can vouch for Elise on the need for a sobering center in South County. Just from a resource allocation standpoint, when we have an individual that is unable to care for themselves because they're under the influence of alcohol or drugs, if it's going to be non-criminal, then we end up driving up to Santa Rosa for a detox center. Whereas, we don't have the availability down here, which if it's a law enforcement unit, it's taking a unit out of service for anywhere from 30 minutes to an hour. Thankfully, the SAFE team has helped out significantly at taking individuals that are, serial inebriates or unable to care for themselves and handle those transports for us. However, that's taking them out of the service also, which their services may be needed on a person that's in crisis and, on the verge of, maybe harming themselves or others. So having something that's closer than the county seat up in Santa Rosa would definitely provide a resource that would be used on a regular basis by not only us, but probably our local partners of Cotati and Roanoke Park and Pengrove and the unincorporated areas, to both the east and the west of us.
Dr. Felt, based on your experience, is a sobering center a good strategy?
Listen, I'm inspired by Elise and everything that she's, calling to action within our community. Of course, we could use more sobering centers. I'm not even sure what you mean by a sobering center. Working in an addiction treatment center myself, I mean, that can mean a lot of different things. We don't have enough detox centers. We don't have enough support systems. Sonoma County has some of the highest dual and triple diagnosed patients of any place in California. So we're definitely in need of more support and education. But I kept thinking the whole time I think our school systems also really need to focus on wellness in general. We listening to Lieutenant McGovern's stats on DUIs being up 230%, controlled drugs up 200%, and more crime. That just speaks to the triggers that cause addiction in the first place. So if we're not focusing on wellness, but also teaching kids about how to take care of their own emotions in school is like an important part of the curriculum, which I don't know that, I see it happening across the country, but it only feels like it's just now starting. Most schools will only have one director of counseling to help 1,000 students. It's just not enough. They're tasked to help deal with all the emotional issues that are occurring within their population. So yes. We definitely need sobering centers. We need more wellness prevention. We need more drug and alcohol prevention. And the opiate addiction, I want to just add to Lieutenant McGowan mentioned some of the causes for opiate addiction. Another big cause for opiate addiction is daily marijuana use in teens. Teens who smoke regularly in their childhood are 3 times more likely to become opiate addicts. That's one of the reasons why we founded Panaptic, because we were seeing the rise of opiate addiction and thought, okay, if we can just tackle the cannabis prevention earlier on, then we might be able to slow the rise of opiate addiction. And in fact, opiate addiction hasn't gone up surprisingly as much as you would think. But what we have seen is more kids using to deal with negative feelings more than they have been using because they just want to experiment when it comes to cannabis.
What you said about kids needing social emotional support, and I know that social emotional learning has been a big topic in education for a long time. In most cases, I think that means integrating those components in with other educational pieces, but it also maybe means separate separate instruction around that, or counseling, as you're saying, having a school counselor. Does anyone on the panel know what the situation with social and emotional learning in Petaluma in the schools? I know we don't
Well,
really have a school person here.
we don't, but we do have really strong counseling services, and they utilize an internship model. But again, I think that the capacity is so hard to actually touch the number of people that need to be touched. And I think, again, once that on-site counselor is able to provide the initial social and emotional support, they have to hand them off somewhere. And the handing off somewhere is stretched to capacity. I think we're probably the only community-based counseling clinic in Sonoma County right now that doesn't have, a 400-person wait list. Our wait list is very low because we've intentionally built up our clinicians so that we can meet the needs, but it's hard. And there has to be a need so that therapists can make the referral, and they're making the referral to the young person and the guardian or parent. That guardian and parent, if they're dealing with the same kind of addiction issues or other issues that they can't address, then that referral never actually happens. And that's kind of that start of that cycle. So, we have to do better. And sometimes that means breaking the old models that we've used and coming up with creative, different models. But there are different things that are being done in different parts of the country that have had some big success. And I want to encourage us to not just take the same path. And I think Petaluma City Schools is really, they've got key people there now that are looking at different solutions outside of just the normal things we've always done. Because it's interesting. People say, oh, we're going to get back to normal. And I hope we don't get back to normal, because that normal wasn't great either. We have this opportunity now to say, let's take it 4 notches up. Let's move it to a different plateau. And we can do it in this community. I know we can.
Yeah. Okay. And I'm remembering also that Mentor Me is another. The Mentor Me program is another way to provide emotional support for
Yes.
kids.
And we always need volunteers for that too.
In the school context, yes. Okay, so we have about 10 minutes left. I just want to invite questions from the audience if there are any. We also have, I just want to acknowledge Councilmember Posake is here, which Elise did, and say welcome. And I don't know if you have any comment or question that you want to ask, sir.
Yeah, can you hear me, Lou?
Yes.
Yeah, what I've been thinking about, some might say that I sometimes have a one-track mind, but when we talk about the kids taking or using marijuana regularly for not for just experimentation purposes, but for dealing with negative feelings, I can't help but go straight, which doesn't get mentioned that much when we're talking about this, but I'm sure Dr. Van Felt must see this, is, I'm concerned about, I'll be brief, racism being a source of negative feelings in people of color. That's what I'd like to hear more about.
Thanks. Is there anything you want to say about that, Dr. Van Felt?
I can't think of a greater, more impactful cause for stress and for in a young person than racism. And so certainly in the last year, we've seen a real shift in our awareness of what's actually right in front of us. And it's no coincidence that addiction rates in low SES, low socioeconomic neighborhoods suffer from higher rates of addiction. And actually, we also know that that the tobacco and cannabis and alcohol industries target those communities to market their product because they know that they're going to sell more. Why? Because more and more of those individuals need to escape the suffering and the pain and the stress that they're going through. So when thinking about having sober centers, and I'm loving that word, Elise, by the way, I just want to keep saying that. I want to have more sober centers pop up. We would want to have them in the neighborhoods and need them the most, but there's also, so I could go on, but that's my initial reaction. Of course, the big cause.
We did have a question in the chat. What are the logistics in creating a sober center? Elise, do you want to talk about that just a little bit? Maybe a little bit more about exactly what you're talking about and what would be needed?
Well, I know that it was Rob from PCRC, so I think that the next 5 sessions could be on a sobering center. There's different models throughout the United States. I often look to Minneapolis for a lot of the information and programming that we have that can be developed and used. And so they have a strong network of sobering centers, and Asheville also has a good network of sobering centers. And so there's models that exist. I think that, the beauty of Petaluma is that nothing happens in a silo. Everything is discussed, and I think that the community could come together and share with us and inform us on what kind of things that they would want us to have at the sobering center. And to the point made earlier, those centers need to be accessible and where people are. They need to be able to walk in, and they need to be able to get to a point where they're ready to say, I need this help, and it be easy and accessible for them to get to. So, it's again, it's a pie in the sky thing, but I'm telling you, day 2 with the SAFE team, one of our crisis intervention workers came in and said, okay, I know I've only been on the road one day on the rig, but I can tell you right now what we need in Petaluma. So it is something. So, it is something that's not going to happen in record speed. Remember, we did the SAFE team, the city came to us in March and we launched in July, but it is something that we know we can get additional funding for. We know we can be a pilot program for other parts of the county that then could trickle down to other counties to use. So it's on our radar.
I did want to add that the county is actually beginning to look at sobering centers, and they have just formed a planning committee to look into this. So I understand the need to bring something local and into Petaluma, but also to be aware that this topic is being discussed countywide now.
Thanks, Donna. Okay, any other questions from the audience, or do any of the panel members want to ask another panel member a question? Sometimes that can produce some interesting additional information. Yeah, go ahead, Richard.
Yeah, I was wondering, Donna or even Elise or Lieutenant McGowan, this might come as a surprise for some of the listeners, but due to the fentanyl problem in the country, a lot of communities are introducing fentanyl test strips as a harm reduction model to prevent overdose. And I'm wondering if we have embraced this offering free fentanyl test strips as a harm reduction model. So harm reduction is an important part of having a sober center, by the way.
I can tell you that the fentanyl testing strips are definitely something we're talking about. I don't know that we have a supply of them right now, but it's definitely part of the conversation, and it goes along with the naloxone Narcan training and availability.
Good, wonderful.
But that plays into your what we need more of is more use. We don't have enough trained addiction specialists to help provide the services that once we, it's just like, we heard this argument, don't test for COVID because you're going to find out you have it and we can't treat it. If we're going to really invest in testing and we're going to really invest in sobering centers, we also need to invest in additional resources and services that can be available for a variety of different people through a variety of different mechanisms in order for them to get those services too.
And to kind of reiterate some of the conversation, we need to destigmatize substance abuse as a culture and a community. And part of that goes with creating safety mechanisms for the user, right? And Manning Walker, who is he's the program manager that works with Elise on the SAFE team. He's been pretty insightful when it comes towards different programs that other cities are using. He comes from Oregon, so they had kind of decriminalized some of the substance abuse well before California. But a needle program, a fentanyl testing strips, there's a variety of things that we could proactively do to make it safer for the addict. That would help destigmatize, which would ultimately help them feel comfortable to have those communications and ultimately potentially seek help when they're ready, when it's time for them. And, but we have to reshape how we look at substance abuse and addiction.
You all, I want to add to that too. This is Dr. Von Felt. We also have in place hundreds upon hundreds of recovery meetings in our county, and there's probably 340 something just Alcoholics Anonymous meetings. That's just one type of recovery meeting that's in Santa Rosa. And Petaluma has a lot of meetings: Narcotics Anonymous, Marijuana's Anonymous, Cocaine's Anonymous, Overeaters Anonymous. Again, and there's many types of programs, but most people don't know why they're there. There's a stigma for even going and getting support in the first place, which is part of the education that we need to do a better job of, perhaps at a younger age, so that it's not a stigmatized thing that you would to even want to try to get help in the first place. But there's a lot in our community that's there.
I know Casa Grande has a teen Al-Anon club on campus. So that's if you've got a loved one who has a addiction issue, and it's led by one of the instructors on campus, and the teens participate weekly meetings. So those programs exist. Again, I think to everybody's point, there is a stigma around using, and it needs to be normalized so that we can figure out how to make the treatment easier for those individuals to access.
Thanks, Elise. We're pretty much at the end of our time. I want to thank Dr. Richard Van Felt and Donna Newman Fields from the Health Department, Lieutenant Nick McGowan from the Petaluma Police Department, and Elise Heppel from PPSC. Our panel tonight was fabulous. This was a really rich conversation. And throwing it back to you, Ted.
And thank you very much. And I want to thank Lou Zweier for moderating, and our panelists and all of our listeners. Obviously, this is a big topic and has lots of component parts. And I think we've touched on many pieces of it that will give us ideas for thinking about and what our community needs, and to help us continue working together. So thank you to all of you, our panelists, and those listeners we can't see, the listeners we can see, and have a very good evening. Thank you.
Good night, everyone.
Thank you.